Okay, welcome everybody. I'm going to go ahead and get started. So thank you all for coming out tonight. Happy April. And we are really excited tonight to have Bridgette Picou and talk to us about navigating the healthcare system. A few announcements first. Next month's Positive Life program will be on neurological complications with HIV, so neuropathy, memory issues, things like that. And Dr. Harold Aronow from TAP, target practice at USC, will be joining us for that as well. So excited for that. And also, you may have seen it in the newsletter and some of the mailings, but we do have the Positives of the Aging Project. I can't hear. We have the Positives of the Aging Project coming up in September on Saturday, September 23rd. And Peter Staley from ACT UP, one of the original activists, will be our keynote speaker. He recently published a book, and I think he's going to be doing a book signing event while he's in town as well. So we're really excited about that. And then
what's the date on that?
Saturday, September 23rd. Mark your calendars. We'll be sending out a save the date in the next few weeks. So we get the word out to the people. And then finally, for World AIDS Day, we are partnering with the AIDS Memorial Sculpture folks to do a seminar, and that's going to be on Friday, December 1st, here at the Camelot. And we're inviting people from the RID Collaboratory to talk about HIV cure research, and also the City of Hope patient, who many of you may have seen him in the news this week. They kind of publicly announced his cure in the media. It was announced at the Croy conference a few months ago. And so he's kind of officially come out in the way that Timothy did. And he lives right here in the Valley, and he's going to be speaking for us as well. He serves at our advisory board for cure research. So we're really excited about that. So just a few things to whet your appetite for what's coming up. Oh, and also lastly, for the World AIDS Day, we're working with the city of Palm Springs to put a star for Timothy Ray Brown in front of the AIDS Memorial Sculpture. That'd be very fitting. And Timothy, as you know, lived here as far for many years before he sadly passed away. And there's going to be a GoFundMe for that. These things are not free. We were kind of surprised to learn that the city charges $15,000 for one of those little stars. So we're going to do a GoFundMe for that. Yeah. And we'll start including that link in our mailing and so forth. So please share that with friends. If you're able to donate, please do. We look forward to being able to honor Timothy for his contribution in the way. So without further ado, Bridgette, come on, thank you.
Hi guys.
What's up, Bridgette?
Hi, Bridgette.
I'm gonna grab my tea real quick because talking does that. It's nice to see everyone. Familiar faces, not familiar faces, but I'm definitely happy to be here with all of you this evening. So I'm going to talk a little bit about navigating healthcare. Most of this is going to be information that you know. Some of it may be new, some of it is maybe reminders, but I think that it's important to revisit things every now and then to kind of keep us going and moving in the right direction. And one kind of disclaimer is that I'm the straightforward kind of person. So if I say something that offends you, charge it to my head, not my heart. It's not on purpose. It's just that I believe that plain speak is better than dancing around certain things. Okay, we're all in agreement with that?
Yes.
Excellent. All right, so a little bit about me. I am Bridgette. I'm a nurse here in the Valley. I'm a licensed vocational nurse. I also have a certification in AIDS care. So I've been doing HIV work for my whole nursing career, which makes it seem like it's been forever, but it's really only been 10 years, but that's still a good period of time. I am also a woman living with HIV. I've worked for a couple of healthcare facilities here in the Valley. I currently work for an online resource organization, nonprofit, called the Well Project, which specializes in women and girls living with and vulnerable HIV. So I am in and out and around HIV in every aspect of my life and happy to do it. It's good work and it's necessary work. So to get us started here, so kind of the agenda, I've already introduced myself. We're going to talk about appointments and relationships with the people that you see and make appointments with, and your doctor, your clinician, whatever that happens to be. A little bit about insurance. I'm going to touch real briefly on caregiving and caregivers, and then screenings, and we'll talk about change. Real briefly. And really, I'm going to breeze through most of this because I want to be able to take your questions and help where I can. There are going to be some instances, I know because I've done this before, where you're going to ask me something and I'm going to tell you to ask your clinician, and it's not because I don't want to answer, it's because that is the person that you need to ask these questions of, because this is the person you need to have that relationship with. So, a little bit about, so the navigating the healthcare system is frustrating. We all know that. It is especially frustrating when you're living with HIV because you are dealing with everybody's favorite stigma, right? So what I hope to do is just give you some tips and tricks to help you navigate a little easier, give you some ideas and directions that you can go. By no means do I have all of the answers. By no means do I think I am right about everything. But hopefully you gain something from this, okay? So on appointments and relationships, one of the biggest things that I can tell you about appointments is keep your appointments. Keep your appointments, keep your appointments. It's important to your healthcare. Get into the habit of making your appointments in advance and not waiting until the last minute, because one of my favorite expressions is your lack of planning is not anyone else's emergency. And I think that we forget that because we feel ill or we feel sick, or there are things that we want to have taken care of right now. So if you make the habit of making those appointments early and then keeping them, you run into fewer situations where it is an actual emergency. And you don't have to depend on someone else's whim, ability, so on and so forth. If you are being seen somewhere new, so you change healthcare providers. If you are going to a referral that you're sent to, disclosure is up to you. You do not have to disclose. If I'm going to see a podiatrist, what do I need to tell them I have HIV for? You guys probably already know that, but it can be a stressful situation. What if I'm going to see a GI doctor because my ID clinician has referred me to them? Then you should probably disclose. There's a reason that your ID clinician is sending you to see someone else, right? So take it on a case-by-case basis, but remember that it really is up to you. I also, because I live the dual life, I think that clinicians have a responsibility to read your chart and know what you're walking in with. Does that always happen? Nope. We know that. So part of all of this is the self-advocacy part that comes with living with HIV, and it can be very exhausting and very frustrating, but it's also very necessary for you to be sure that you get the kind of care that you need and the kind of care that you want. The rest of this is familiar. Your appointment frequency is going to depend on how long you've been living with HIV, what kind of relationship you have with your provider. Please be aware, though, this is where the nurse in me comes out. Sometimes facilities, even if you've been going there for 50 years, change policies. It is not the staff's fault that the policy changed. I can tell you that I've been yelled at, hollered at, screamed at, cussed at, all of that as a nurse because a policy changed. And I get it. I'm a human being too. But just try to remember that the ancillary staff and the people that are there most of the time are really, really, really there because they care and they want to help you. So keep that in mind. Relationships are important for obvious reasons. If you are with a clinician that you can't trust and that you can't stand, you're with the wrong clinician. You have the right and the ability to change clinician. I would just caution you in all cases, if you're going to change your whoever it is for whatever reason, make sure that you have all of the refills that you need. Make sure if there were tests that you were ordered to have done, you have those tests done. Because sometimes when you change clinicians or insurance or what have you, that means you have to start that referral process or whatever the case may be all over again. And you want to make sure you have what you need so that it doesn't become an emergency. Does that make sense?
Yeah.
Awesome. So we already talked about this. And what I want to call out on this slide is that it is not therapeutic to continue to be with in the care of a clinician that you don't like. So I really do believe that I don't have to like you, but I do need to know that I can trust you and that I believe you know what you're doing. So, I mean, I love a clinician, but if they're efficient and they're doing the things that I need to have happen for my care, I may stick with them. But if it's both of those things, I don't like you and I don't trust you, it's time to find a new clinician. So what do you need to bring to an appointment? Relevant copies. You don't have to bring 10 years of life. You don't have to bring 20 years of life. Bring at most the last 2 years, or if you've had major surgeries, major life events, bring that kind of stuff with you. A good list of questions that you want to ask at the appointment. We all know and are very frustrated by 20-minute appointments, right? Very frustrated by 20-minute appointments, but it is the way that healthcare has come. So as a rule of thumb, bring 3 to 5 questions that you want to have answered. Make the first 2 questions you're burning. I absolutely need to address this with you questions because that's probably all you're going to get to. What do you do about the other 3? Send them through the patient portal. That's what your ancillary staff is there for. Your nurses, your MAs, assistants, they read those things. They pass that information on to your clinician. So bring those things to their attention. And then any copies of recent testing. If you got referred out for an MRI or an X-ray, when you're there at the facility that you're having that work done at, ask for copies, ask them to email you a copy. Medical records is not fail-safe. You know, technology, as we learned tonight, technology is fabulous when it works, but it doesn't always work and they don't always communicate. So bring what you need. It's better to have it and not need it than need it and not have it. Should the referring office send it over? Should the office you're coming from request that information? Absolutely. Do they have their responsibility? Absolutely. Do you want to advocate for yourself? Even more so, absolutely. So keep that in mind. So everybody's favorite. Lord, I am not an insurance expert by any means. So rather than try to be that, this is what I'm going to give you. And I'm happy to share this slide with you guys too. Insurance changes every year. Be aware of that, be prepared for that. Start getting those notifications about your options for changing. Don't ignore them until the day before you have to do something about it. Start making those phone calls. Start asking for help. If you can get an insurance broker to help you, get an insurance broker to help you. Now, I know from this last year when insurance enrollment came up and changed, I'm under covered California. I have to call twice to get correct information. Because the first person that I talked to, something in the back of my head told me that they were wrong. And when I called back the second time, I found out I was right. So listen to your instincts. It's okay to double check. It is okay to ask questions until you and the person that you are talking to are completely exhausted. Ask your question. You need to have them answered because it is your health care and it's going to affect you for the rest of the year. So ask those questions. California has a program called HICAP, which will assist with navigating Medicare. I have the website here and there's a phone number here. You can take a picture of it or you can have the slides like I said. But they contract with the Department of Aging, which also offers additional services. So in case you didn't know, aside from most insurances have a provision where you can get rides to appointments, like a specific number of appointments, but they do run out, right? Like you get 5. Once they're done, what do? You call the Department of Aging and tell them, I need to get to XYZ appointment and see if they can help you. It is for persons that are over 60. Well, Bridgette, I'm not 60 yet. Okay, but you have a qualifying health condition. Call them and ask them. Squeaky wheel gets the oil, closed mouth doesn't get fed. Ask the questions. So these are, this may be of assistance to you. So keep that in mind. Next step, when it comes to insurance, is our drug coverage. Does anybody know how much the average HIV med costs per month without insurance right now? worth about $4,000. Yep, that's exactly correct. That's hella expensive.
Yeah.
So you should be asking your pharmacist, your pharmacy, and the drug company about copay cards. Now, copay cards don't always work. Sometimes they don't work with Medicare, or sometimes they don't work with private insurance, vice versa. Ask. Closed mouth doesn't get fed. If that particular program may not work for you, there may be something else that does. Ask at whether it's a hospital or your clinic, is there a financial office or financial assistance that can help? There's a gap to help, which doesn't cover everything and has a cap. But you should be basically exhausting every option and opportunity you have to pay for your medication, even if you feel like you can afford your medication. That makes sense? I can afford my copay. Do I want to spend that? No. If I can make the drug company pay for it and give me a new pair of heels, guess what I'm doing? Just saying. So exhaust your efforts to find alternative ways to pay for your meds. So your healthcare is your responsibility, but that doesn't mean you have to do it alone, right? So everybody needs a little healthcare in there. On that note, we're going to talk about caregivers real briefly. There is no shame in having a caregiver. There's no shame in having a caregiver. The caregiver doesn't necessarily have to be helping you with activities of daily living, which is great if you can get it. This could be the person that helps you make your appointments. This could be the person that reminds you to keep your appointments. This could be, I'm skipping ahead of my slide here because I get enthusiastic. This person should be someone that you trust, and it may not necessarily be your best friend, cousin, partner. In some cases, it's better if it's not that person, because you need a balance sometimes when it comes to your healthcare. But this person can attend your appointments with you to help you on track. They can remind you to ask your clinician about things that you may be forgetting to ask about. So consider that once you find yourself, if you find yourself getting confused, or things are frustrating, whatever the case may be, caregivers can help with that, and there's no shame in that. You also may want to consider a power of attorney, which is giving someone the right to make decisions for you should you become unable to do so. This could be the same person, or it could be different people. You can have one for medical decisions. You can have one for financial decisions. This could be the same person in both cases. A living will or some kind of document that states what you want. My mother passed recently. We had brief conversations about, the fact that she was going to haunt me if I buried her in the ground. But, other than that, she didn't have a will in place, and it would have helped. Right. So consider those things. They're things that are hard to think about and that we don't want to think about, but there are things that make sense to have in place for your loved ones or whoever is going to take care of your affairs once you're gone. So I like caregivers. I did home health for a long time, and my patients' caregivers were my lifesaver as a nurse, because what my patients didn't know, their caregivers did. So not a bad thing. Health screenings. So regular health screenings are a way for you to stay healthy. I hate to make the comparison and to even bring it up, but it's kind of like with the vaccines, right? Some people wanted them, some people didn't. But having them was better than not having them in most cases. Screenings are like that. You don't necessarily want to have someone check your prostate, but it's a good idea, right? So even if you think that it's not something you need, ask your clinician about that, because there are things that you may need right now that you thought you had taken care of, like certain vaccines sometimes. If you had them once already, you may think you never need to get them again, but maybe the efficacy of that vaccine has waned. Like, for example, Hep B is a great one. A lot of people have had the Hep B series, but your immunity to that can wane over time. I had to have that series 3 times before it stuck. So those are the kinds of things that you need to think about. For folks that trans experience, to make sure that you are talking to your clinician about native screenings and things that you should have had that would have been regular for you to have before you transition. You may still need those. And that's something that a lot of people don't think about. So keep that in mind. And screenings can be a challenge with insurance. So right now I want to have a bone density screening. I turned 50 recently. And it's not recommended for women at 50, but I've been on antiretrovirals for the last 10 years. I'm shorter than I was 2 years ago. I know it because I measured myself. I want that screening. So now I have to advocate for myself a little bit. To get that screening. So do you see where I'm going with this?
Yeah.
So I have a list of screenings here. It is by no means exhaustive, but looking at it may give you an idea of something that you've overlooked. So blood pressure, cholesterol, your cancer screenings, dental screenings. I hate going to the dentist. The drill is not my friend. Exactly, that sound right there. Lung cancer screenings. If you are a smoker or you quit smoking, congratulations if you quit smoking. I'm a nurse. I am obligated to tell you if you're still smoking to quit smoking. But if you are, make sure you have your regular screenings, okay? Immunizations, your pap smears, osteoporosis. Yes, gentlemen, osteoporosis is a risk for you too. So you need to have those screenings as well. Okay. All right. So, change is inevitable. Changes in our health is inevitable. We can't all be strong and fit and 40 or 30 or 20 anymore. We are getting up there. My knees, my back, and my elbow complain every morning. But the good thing about it is that if we take the time to do the things that we need to do, regular exercise, incorporating some mindfulness or some meditation, sleep. Sleep is vital. Hydration. Hydration is one of my favorite words. People know that. I'm always telling people to hydrate. These are things that can make aging easier and slightly less stressful, because really a lot of our health care issues as we age are about the emotional things as much as they are about the physical things. So things like stress affect us more than they may have in our youth. Things like being unsettled mentally affect us more than they did when we were in our youth. Loneliness and isolation is a thing for us as we age. A community is extremely, extremely important as we age, especially if we want to age in place. So if I don't want to move into a home or a facility, then I need to have a village in place to help me stay in my house. So these are things that you need to start thinking about now so that it doesn't pop up and become a thing suddenly next year. Not wrong with having a caregiver. A caregiver can cut down on some of that isolation and some of that loneliness. And I can tell you as a nurse that loneliness and isolation and cough from people is going to be a bigger detriment to your health than anything else. So with that, the greatest discovery of all time is that a person can change his future merely by changing his attitude. So, what questions do you have for me? Because I'm happy to answer them. And thank you very much. Here's my email address. You can reach me there. What questions do you have? And I breezed through that really fast because I really do want to have a conversation with you all about the things that you want to know. Yes.
Hi, Bridgette.
Hi.
Hi, Bridgette. You were my nurse with Dr. Shadwell, and it's really great to see you. I thought that was an excellent presentation. Thank you so much.
Thank you.
My question about loneliness and all of that is coming out of COVID and having to be isolated. Besides coming to groups like this and my AA group, I kind of turned into a loner and, I asked my doctor about it and I tell my doctor about it and I'm supposed to call my insurance card, but I hate those 800 numbers. And I know I have to be the biggest advocate for myself, but could you just talk about maybe the effects of COVID and the results of isolation, I think, for a lot of the world besides HIV patients and
Yeah,
something along that topic, maybe?
yeah. So we all know that for people, long-term survivors of HIV, COVID brought up a lot of emotions and a lot of feelings of what it was like in the beginning of the epidemic, right? That feeling of being not only cut off, but of being scared to touch people. Having to maintain that 6 feet made us feel that loss of connection. And so one of the best things that I can tell you, because you mentioned calling the number on the back of your card, it is an option. However, there are things that you can do, everyday things that you can do that you may not even be thinking about that are super fun because it incorporates getting around people and exercise. So what about joining a bowling league or a tennis league or starting a walking club? Like this is part of building that village that I'm talking about, right? So you and 4 of your buddies decide to get up and walk 2 blocks every day or whatever you can tolerate. So there are ways and things that you can do to combat that loneliness and isolation that A, don't necessarily cost money or don't cost a lot of money, but B, give you the sense of you doing something to take control back of your life. I know that, like for me right now, for example, I'm an expert on my own experience, which is why I keep using myself as an example, but I'm working from home right now. I don't love it. I miss being in a clinic around people and touching people. Yeah. And for me, one of the biggest struggles of COVID was hugging because I'm a hugger, right? I like that human connection. And so I'm having to find alternative ways to get out of the house and do things and be around people. But I'm also finding that it's very stressful to be around people. I went to a conference a couple of months ago and there were like 3,000 people there and I was wigging out because there were so many people. And it really wasn't about COVID. It was really just about navigating being around that many people with that much energy and all of that conversation and all that stuff going on. But sometimes the only way to get to something is to go through something. And so you have to force yourself out and force yourself to do the things that you used to do or find new ways to do the things that you used to do. So keep plugging.
Just to piggyback on that, give a plug for the Let's Get Gas group here, which is formed for just that purpose. And they've got pizza nights, they've got coffees almost every week. They've got a round table. What do they bowling? Yeah, they do bowling. I think they have hikes, potlucks. So yeah, there's lots of opportunity to get together with other POS folks. Because I know sometimes the stigma, people accept it, what about my meds? What if I'm not 100%, that sort of thing. It's a really great group. And one thing HARP is going to be doing, we've gotten some funding to put together a virtual village where people can connect online and connect with all the various services in the city. So in the next month or so, we'll be launching that. So they can figure out. You're right, it's a huge issue. We did a lot of research about it during the pandemic. And across the board, everybody, positive or negative, gay or straight, old or young, it affected everybody. And I think, one thing we found out from that research is that people who have been living through HIV for 40 years actually have more resiliency. It affected them, of course, but they knew what to do and didn't kind of fall apart the way some people did. Early on, we didn't want to touch people, we didn't want to have sex, things like that. So, we've been there. And that's one thing I kept telling people during the pandemic, because it's not our first pandemic rodeo. We've been living it for 40 years. So got a leg up on some of them.
And here's a radical thought. Get ready for this. Did you know you didn't have to hang around the same people you've always hung around? How about that as a radical idea? You can actually get out and do different things with different people. And not only will you enjoy yourself, but you might learn something. Okay, just saying. I'm that kind of girl, radical thoughts. Who else has a question?
I understand that Borrego and DAP and a couple other organizations are going to be some mega provider. Do you have any knowledge you can share or any ideas of how we can negotiate those situations? My main concern is right now is that Prego keeps its pharmacy going the way it is.
So that's actually a really good question. And because I am not in with the in crowd anymore, I can't tell you what that structure is going to look like. I can't give you nursing advice for navigating that, which is making sure your prescriptions are up to date. So I don't think anybody is listening who I can actually get in trouble with for saying this. So I'm gonna say it anyway. Like right now, during the pandemic, you could get 3 months worth of your HIV meds. They're now kind of switching back to where with certain insurances, you can't do that anymore, right? You just get the 30-day supply. But did you know, a little birdie told me that you get one vacation bill and you also get a lost prescription bill. So take that information and do with what you will, but you could prepare yourself for a little bit of chaos and a little bit of a period of change in small subtle ways, right? So the best thing you can do is, again, make sure that you're up on your appointments, make sure that you're up on your refills, make sure that all of the prescriptions that you need, you have. And some of this is going to be, if you haven't seen your clinician in 6 months and you call and ask for 10 prescriptions to be refilled all of a sudden out of the blue, it's not going to happen. You're going to need to go be seen. Don't be mad, just go be seen and get it done. So that's part of what I'm saying about like not planning someone else's emergency. If you do things in advance, you have them and it's way less stressful. So start thinking about like taking a look at your medicine cabinet and seeing what you have and what you might need. Start taking a look at those referrals that you've been putting off going to because it's it's after COVID and you don't feel like it. Go take care of those appointments. Go do those things so that you are ahead of the game in case the game gets a little wild, because it might. Any other questions?
Raymond has one.
Bridgette, Raymond.
I just want to let everybody know if I heard.
Yeah. Okay. Set the mic.
Getting old. My experience with kick-ass is that everybody in this room that I know is, I did know a couple of people before the kick-ass meetings, but even if we don't become friends, it exposes you to a lot of people, and so that you see them at different events, and so that's another reason why kick-ass is very important to all of us. One thing that I think I'm going through that probably a lot of us are, because we are the older set, you also get this factor of just complete burnout. We've been doing this for so long, and then to be confronted with a new doctor who wants to start all over again. Okay. So I have been guilty of letting some of these referrals go because it's like, well, my last bone density test wasn't that great. Probably not going to do anything, even if it's not great this time. So I'll just put it off. And then by the time I don't know if the referral has expired, my doctor doesn't talk about it anymore and life goes on. So,
Yeah.
But I did want to bring up just just say it for myself that I've been experiencing a tremendous feeling of I don't want to do this anymore.
It's exhausting. And kudos for even admitting that, right? Like I give you credit for that. I also have an untold amount of respect for people that have been doing this for 20 and 30 years. Like in my 10 years, which is, so there's this thing, I say I've been positive for 10 years and some of the long-term survivors goes, oh, you're a baby. Okay, it's relative, but okay, I'll take it. I was diagnosed at 40, which, was a milestone for a whole bunch of different reasons. And so the last 10 years for me have been really firmly aging with an HIV diagnosis. And so the fact that you're still here means that there's still purpose and there's still stuff for you to do. And you are correct. When you are around other people of shared experience, even if your experience is not exactly the same, you can learn from each other. So you're sitting in the hallway and two people are having a conversation about their last experience with their clinician, and you can learn from that. Or there's another set of people that are over talking about this great new gardening club that they joined, and you can learn from that. And so it's really important for all of us to be in community with each other so that we can continue to lean on and learn from each other. And so don't let the
One thing that you are making me aware of is you're like, well, good thing, or it's great that we can access these things. You know, don't be lax and not take advantage of the situation. I know that your organization, I believe it's like a nationwide organization of chapters of other places. And so you must have the experience that our Palm Springs care is really unique and great. But those of us here are discouraged by DAP and other things like that we don't get out of it. That maybe in the old days we did, because we had certain amount of HIV specialists and they knew our name for 10 years and knew what we did for professions.
Yeah.
And now we're dealing with a set of doctors that don't know us from Adam. So
it's frustrating, and it really, what I can say about
But I
that.
guess my point is, and I haven't talked to about this by other clients when I do go ranting. It's like, you know, I come from not North Carolina, maybe Arkansas or somewhere. I'll just throw that out. But then I didn't have a doctor, you know, within 50 miles. And even when I got there, he's like, what's HIV? And so, I'm
Yeah.
like, okay, so we do live in a great place. And you're exactly right. We need to take advantage of the services that we are offering.
But your experience is valid, right? The HIV clinicians that have been doing this for a long time they're getting older. Some of them are retiring. There are new heads coming in that don't know as much as the older ID clinicians know. And in some cases, maybe they don't want to know. But the reality is that we have to take each experience and build on it. So you may have to coach a new clinician just a little bit, but try to also keep in mind that there's for me, there's a sense of gratefulness that they even want to do the work, right? And so as frustrating as it may be to have to teach someone about your experience, they're there because they are willing to learn it and pass it on, and continue to make sure that we have care, because it's really important. HIV is such a specialty, unfortunately, in my book. I don't feel like it should be a specialty after all of this time. I think that it should be taught more. I think there should be more information readily available about it. But you are correct. Your experience is your experience, and it's important. Anybody else?
I only want to say that you are exhibiting what nursing is, and nurses are the best.
Oh, thank you so much. I appreciate it. Thank you.
Jim? Oh,
It's a pleasure to see you tonight. I miss seeing you. Just to say that first. There is a huge changeover taking place in the valley, and it's been difficult for everyone I know who has been going to wherever, Borrego, DAP, wherever. It's been difficult because there's been changes that are made that have been making all of us a little crazy post-COVID. And we're talking about people who are self-advocates and have been actively involved in this program. So my concern right now is, as a ex-caregiver, because I've given it up, it's just overwhelming at this point. But I do want to say, there's a large group of younger people out here that are not on Medicare, that are on IHP or some sort of health program, that are still not getting the services, even with that. And what is your suggestion that you can offer to this group that we can bring to the community? Because I know Park does a lot of work and I'm actively seeing it. But I'm just thinking like, so much more. You know, this bubble is quite large. Palm Springs is a very special place and I totally get that. I lived in Florida before here. In Fort Lauderdale, it was in a bubble. It was lovely. The healthcare was not good. It's a much better field. But I want to say, what's the future holds for younger people? Because they're still catching HIV. And it's not like it's not happening. So what is the advocacy going to be? What do you see?
So there are a lot of outside of Palm Springs in the general world. I have the blessing of being able to go to conferences, right? Like and it is exactly that. It is a blessing because I learned things at conferences that I would never learn sitting in the Palm Springs bubble, right? For lack of a better way to put it. There are people that are out there that are doing the work and that are pushing and that are trying to make a difference. And we're talking about in all areas, we're talking about trying to prevent these youngsters from acquiring HIV, to trials for cures, to research, to trying to motivate more people to get involved in the work. The frustrating thing that I find when it comes to the youth is that they really, you know, for a lot of them, it's, oh, if I get it, I'll just take a pill a day and I'll be fine. But they don't understand that there's a whole chasm between diagnosis and thriving that they're going to have to get through to get there. And so my word of wisdom or advice is that I know where I'm from, we call y'all old heads. I know y'all old heads are tired, but you got to keep pushing just a little bit longer because they are going to need us as a collective. Everything worthwhile takes a village. And so it is tiring and exhausting and frustrating. It's hurtful. I've had some people say some wild stuff to me. But it's necessary so that we are there and we are building, because at the end of the day, what you all have been doing for 30 years and what I'm trying to do is build a safety net and build a net of knowledge so that they can have something to fall into when they fall, because they will fall. So thank you for everything that you do and continue to do, and hopefully will continue to do. It definitely absolutely makes a difference and it matters.
Just to piggyback on that. You know, all the more reason to bring up new advocates is because when we get too old to advocate for ourselves, we're going to need them. And she's talking about it takes a village to raise an elder. We're going to be those elders. We're already the elders, but we're going to be old elders at some point. And having those young ones that we've mentored be there for us is going to be really important.
Hi, following up on what you just said, I like what you said about how we need to be there for younger people coming up. I've been at it for 40 years. I'm tired. I'm willing to stay at it. My question to you is, how can we do that? How do we help there? There doesn't seem, at least to me so far, been here 3 years. I don't see a avenue for us to do advocacy, to do any kind of navigating. I've done it one-to-one with some younger guys, but if I had not made that effort, I wouldn't have seen how we could. So from your perspective, how do you see us being able to do that? Or do we need to create some new function in town or new organization? And secondly, just to give my own perspective, I feel that the bubble here is inadequate. I keep hitting a big void with my own care. I'm used to advocating and being, think of myself as somewhat self-aware. But I keep finding voids in the healthcare here and having to struggle upstream. And I've hit the same condition, I think, that was referred to earlier, that there's this turnover. Part of it seems generational, part of it seems to be professional, where people are retiring. But the systems here are under stress, like nowhere else I've seen in California. And certainly not along coastal California, where the health systems are more, for lack of a better word, more fertile. So I just wanted to say that, because I see it on both ends of this, that there are deficiencies, and there's screaming deficiencies from what I see. So what advice would you give?
So you're absolutely correct. And I'm going to work my way backwards. I'm going to answer the second question first. Within advocacy, you know how to advocate for yourself. What I see as a part of the solution to what's going on with the healthcare systems themselves here in the Valley is getting involved from the inside out. So if the healthcare clinic that you are going to doesn't have a patient advocacy board, force them to create one. If they have one and it's inadequate, get in there and make a difference. You have to head to tail, not tail to head. So get in to these places and advocate for the change that you want to see. If you're not a person who likes to speak out or speak publicly, write letters, email. You can auto-generate an email and just keep doing it until somebody answers you and hears you. But for me, the best way to do it is to get into the facilities and get on patient advocacy boards. Make them start those. There are programs, for example, I didn't mention that I'm the president of the local ANAC chapter, Association of Nurses in AIDS Care. So they happen to have a training program to teach you how to be a peer advocate. If you have experience with being a peer advocate, take a buddy, go to a clinic. We need this age group or this demographic or this, that, or the third to be in here to help you with this population of patients. So get in from where the wheels start turning and make them start turning in the direction you want them to turn. And then as far as how you reach the younger people, how you bridge that that gap is to build a bridge. There are groups like, okay, for example, I'm a woman. I don't necessarily feel like I fit into there. So somebody has to reach out to me and pull me in. A young person may not feel like they fit into that group or have a space in that group because of the age difference. Reach out to them and pull them in. You pull them in, they'll pull someone else in, and then all of a sudden, hello, radical idea, new group of friends, new group of people, new blood, new people learning what you already know and how to apply what you already know. So it's just as exhausting as it is, it's reaching out and continuing to do what you do best. You can do it by rote. You've been doing it for 30 years. You know how to do it for 40 years. You know how to do it. So give them a reason to be excited about it. Give them a reason to feel like they belong. And it may not happen the first time. It may not happen the second time. But the third time might be the charm. And ding, ding, ding. Now you have a brand new advocate who's reaching out to his set of friends or her set of friends and bringing new people in. And there's some change there. So change is always slow, but it's the persistence in which you do it that makes the biggest difference. So that would be my advice.
Could I say something first? I just wanted to thank you for mentioning about like bringing people along. And I would challenge anyone that's involved with Let's Kick Ass to invite a friend. You know, the best thing you can do is bring someone along. And I see a lot of people showing up on their own. And I just wanted to comment to Raymond that I meet that same wall. I have an alarm set for 9 o'clock to take my pills. And sometimes I don't take them till like 11:30 or midnight. It's just like I keep putting snooze on. I just don't want to take it again. And one way to mitigate that feeling is to move on to a new treatment. And we do have injectables. So it's kind of like moving forward with what we've experienced to give yourself some relief. And I would really encourage you to look at those other things, especially if you have been meeting that wall and finding it hard to confront. But
Well, specifically with that, turns out that the injectable contains a drug that I am previously exposed to, and so they won't consider me for this injectable, but there will probably be others that
right,
don't contain.
yeah,
And so, yeah, I would look into that, but that's a whole other chapter of it's it's risky to think about doing something that's going to be in your body for 3 months or whatnot, and it's a big change. But at the same time, it goes back to, oh my gosh, we don't want to be dinosaurs here and not take advantage of the latest and greatest things.
right. And it does take moving through that, yeah, and facing it. And then I would see that and think, well, oh, if Raymond could do it, so can I. And other people do notice people that love you and that are involved with you. So thank you for bringing that up, because that is a real big issue for folks. But and invite a friend.
For what he said, what I got out of what he said back there about how do we contact the young guy, or how, the thing that I don't see is the younger person. I think you've met some, but I can't think of like a younger guy that I even know of now that's like we are, open and talking about HIV. Moreover, I feel like it's such a different world for somebody that maybe they're just taking their pill and they're not into the big drama that we are. And so, but I definitely feel that because of this meeting with you, Kick-Ass will do a different sort of an effort to enlarge our scope. I mean, we've already gone from long-term survivors to people who have HIV or are affected by HIV. We're trying to make the tent bigger.
And really impacted. And so many people were trying to avoid it. So they were just as impacted by HIV, and then they got it, so acquired it. So like you're saying, they have been impacted over decades, but it just wasn't until maybe recently that they acquired HIV. So yeah, I would love to drop that long-term part, that it's like we're all survivors of HIV, even if we're new.
Yeah, and that that's a good point, because we all and I am an advocate for any person who thinks that none of us should be just surviving with HIV. We should all be thriving with it. Thriving should be everyone's goal, because thriving is where the living happens. Yes, you have a question.
I was gonna say, LKA is a really great group. I don't get to go as often because I have a job now, so most of the things they do are while I work, so that's kind of unfortunate. But I'm kind of new to being in the desert full-time for the last couple of years. I'm a Kaiser patient, and Kaiser, if anybody's been on that in the Bay Area, it's really great to be able to negotiate, navigate that whole system. But I was kind of discouraged because I went to DAP a couple of times. First of all, and I know they're probably getting overwhelmed, but it didn't feel like they were really all that interested in taking on new people, or really enthusiastic about that. I also found that I'm not seeing any like HIV support groups. I used to go to one in the Bay Area a lot on a regular basis. I haven't found one here. I don't know if there is one. So I'm kind of left with, because now it's really funny because I moved down here, so I changed my address in my Kaiser record. So of course my wonderful what do you call her? She's the nurse kind of in the clinic where I'm from. She's like really happy the social worker, she's really happy to dump me off really quick. She's like, oh my God, you can go to DAP, blah, 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 it's all done. And it's like, no, you can't just go to DAP and snap your fingers and it's done. So I've kept my doctors in the Bay Area because it really does scare me down here. Because I mean, as much as I came down here because there should be resources as we get older, there really are very limited resources here for what you hear is available, because it's not available. DAP isn't responsive all the time. And I don't know if it is because of all the transitions you guys have all talked about, or if it's because they are just overloaded with so many people coming down here with the same expectation. And, you know, honestly, I've driven all the way to Kaiser and Moreno Valley to avoid going to Eisenhower. I mean, that place scares the crap out of me, you know. But I mean, I'm not trying to downplay. It's just that these are the experiences I've had since I've been here, you know, that's kind of the thing. So I think that if there isn't a support group, it'd be great. If one could be started, I would start it myself if I knew how to. And it would be great too. I don't see like a village fest or anything. There's nobody there kind of, you know, because this is kind of a gay community still here supposedly, but you know, down at like Village Fest, I don't see, you know, I see all the little special interest group, but I don't see anybody kind of still promoting, because, you know, I've seen online, for example, some of these young people, they're stupid. Well, let's have a conversion party. Oh yeah, that makes sense. Let's have a conversion party because I wish I had gotten this sooner, you know, and it's like, you know, there's still a lot of stupidity out there revolving around HIV and everything. And so I guess my first question is, how do I maybe not jump off of Kaiser, but my social worker was under the impression that I could just get some assistance with DAP and they would help me navigate recertifying every year for HIP, as a care HIP, for what my premiums and ADAP and all that, because I also have other friends who've been trying to do this longer than I have, and they get through the process with DAP on ADAP, for example, and it just all falls apart and nobody follows up. So, you know, is there some place that we can actually go to that'll be like a constant and won't be ups and downs? Is there anything like that, or is it just the whole thing's kind of in transition?
Take us through.
Yeah,
Sorry about that.
that's okay. I figured at some point it was gonna come up, I was gonna be put on the spot. So, the honest answer though, honestly, is that, it is a frustrating experience. It's not easy. There is a lot of change going on. I can tell you from experience that there are a lot of really good people that work there that really do want to help and really do want to do the work. This is where the persistence comes in and the advocacy comes in. And as exhausting as it is to be persistent sometimes, it's the reality. There are support groups. And I also want to say in an aside, I did not need to make it sound like I don't love okay, because I do. I was just using it as an example of, you know, the bridge building.
Sure.
But stick with it. You can use your Kaiser resource, like if you can lean on her a little bit until you can get it straightened out to have her help you. Sometimes it does help to have someone from a different institution send over or make a phone call or intervene on your behalf, so you can see if maybe she would be willing to do that a little bit. Again, with like I was saying before about emailing and writing, that does help. I'm really trying to not throw anybody or anything under the bus. But the healthcare system very much is broken, and part of it is going to be desert life. Part of it is going to be healthcare in and of itself being a problem right now, because of all of the, there are certain things that happened during COVID that people really liked and really want to keep. And the medical institution is trying to take some of those things back and doesn't want to continue to do those things. And so there's that little push and pull going on. So there is a lot going on right now. And I would just say, stick with it and do the best that you can. And support group wise, if there's not one that you can find that interests you, start one. You have a whole group of people right here that you can start with. You have neighbors. And here's another radical idea. Get ready. You ready? Did you know you can hang out with people that don't have HIV?
What?
What? and you don't have to disclose your status to them, and you can have a good time with them. Or even more radical, once you get to know them, you can disclose your status to them and teach them something. So my point with that is we don't always have to stay in the same routines. We can do things differently, and we can make waves, and we can make change. Change is slow. Change is hard. Change is scary. And what you and Chris were talking about with the medication changes and things, change is scary. The change is almost always worth it. So be persistent. Fight for change.
We have a question on.
Yeah, Alistair had a question, but did you write it out? A significant part of the system stress is COVID downstream related. I think that was an earlier comment. I'm not sure if Alistair can hear us, but if you could type in your question, then we could relate it to Bridgette.
Actually, I was invited to unmute,
Oh.
so if that's okay, I can say what I was wanting to say. Because
Yes.
the reason I put that comment in the chat earlier was because a lot of people don't realize that some of the major system stresses just now are not because of the disease COVID, but because of the early days of COVID, when people were being laid off and furloughed. The really good folk moved somewhere else and found a job, and generally got paid a bit more. And then when things started to open up a bit again, and they were invited to go back to where they were at what they were paid before, that would be a pay cut for them. So a lot of the good ones didn't come back. So almost everywhere is trying to retrain their front office staff. And when dealing with the front office staff, they're generally doing the best they can, but they're also sort of overwhelmed because the good ones, the really good ones that left, weren't there to train them. And the providers, the practitioners, the doctors are not necessarily the most skilled, people-friendly individuals in dealing with front office issues. And that's why Bridgette's advice on try to be as pleasant as you can in dealing with your providers, with front offices, makes such a difference, because once somebody who's not that confident about their training in front office starts to get defensive, things go downhill really quickly. And that's an unfortunate fact of life, not just in medical situations, but in almost every business that has a front office staff. So I can't emphasize enough how good the advice Bridgette was given in saying, try to be as pleasant as you can. If you can't be present, be pleasant because you're getting frustrated, then try to be polite. Because everyone loses if anyone loses their temper. So that was that point from the earlier thing. The other thing was that I'm not in the desert area. I am still back in beauteous downtown Glendale area. And one of the things that I do is I actually peer facilitate a support group. And for those that are having difficulty because they can't find a support group, if you're willing to get 2 or 3 people together and start just a conversational support group initially, I suspect that the service organizations in the desert area are more than happy to provide some support from that logistically, and possibly drop somebody in who's experienced to seed the group just to get it going. I know that as part of the work that I do with the LA County Commission on HIV, I am trying to encourage the formation, the startup of more support groups. Because one of the other poisonous aspects of COVID was so many of us who were already getting older and isolated were locked down into an even more severe isolation that took a tremendous toll on our physical muscles and took a tremendous toll on our mental muscles, because we just weren't interfacing with other people. So this is a longer comment that I intended to make, but I just would want to agree very wholeheartedly with a lot of what Bridgette said, and also to offer hope to somebody who would like to get into a support group that they're actually comparatively easy to start. And as long as one doesn't have too rigid a set of rules beyond the common sense ones for the support group, people will join it because it's going to provide value to them and they will provide value to the support group. and the shared experiences can it's hard. May not make it easier, but it will tend to make life less hard and gradually more pleasant. Thank you.
Perfect. That was great. Thank you for bringing that up because I actually did forget to mention commissions and planning councils. That's another way that you get onto those and get involved and help move forward the change that you'd like to see. Is your planning commissions and councils and advisory boards, things like that. And a lot of the support groups, I think, of course, had to go to Zoom because of COVID, and they may just be waiting for the right person to get them started again and moving. So, consider that. And you can also really truly start a support group online because Zoom is free. So all you need, like you said, is 2 or 3 friends. So that was great, guys.
Hi, Bridget, just because I trust you and I've known you for a long time, and I'm not trying to cause a train wreck or anything, but can you just do some limited advice on mental health and our general well-being, please?
So it definitely, because I'm not licensed in that area, definitely has to be general. But I will say your mental health is paramount. Finding a few someones to talk to. Like everybody says, find that one person you can talk to. I'm of the mind that you need a few someones to talk to. And a couple of those someones need to be people that you don't normally talk to. Because sometimes people that we love tell us what we want to hear and not what we need to hear. So definitely that's one. Number 2 is I am not a meditation person. I cannot sit still for nothing. I can't. However, mindfulness is something that I can practice because mindfulness can be something as simple as the process of washing my hands. If I focus on what my hands are doing, what the soil feels like, what the water feels like, what the water temperature feels like, it takes me out of whatever moment I'm in and puts me in a more calming space so that I can then go back to and deal with whatever thought, idea, or whatever it was that was negative in my head. So mindfulness is a good thing if you can't meditate. Meditation is great. White noise is far underrated, in my opinion. And it doesn't necessarily have to be just the white noise or the brown noise. You can do, my personal favorite is, it's a mixed sound of train tracks and rain. And it's perfect and it soothes me. So that's something else that you can try. Journaling. It's important, and there are a couple of ways to do journaling. There is the freehand journal where you just start writing down whatever you're thinking, and then you can also buy a book with prompts to lead you through. The other thing is if you are in a position where you have medication prescribed to you for whatever mental, emotional struggle that you're struggling with, take your meds. Take your meds. Meds do not have to be permanent. They do not have to be the rest of your life. They do not make you weak. They do not mean anything other than you are in a position where you need time and space to get over the hump. And medication can be that. It doesn't mean that you're going to be on it for the rest of your life. So if you are resistant to starting medication and you're dealing with depression, anxiety, combination of both, or whatever the case may be, and your practitioner has recommended that maybe that's something that you can do, give it a try. You can always stop if you hate it, but give it a try. Anything that you can do for your mental health. And here's the big thing. Get rid of people who are not good for you. Delete the text messages, delete the pictures, block them on social media if you're a social media person. If someone is not good for you and you know it, why are you holding on to them? Because it's comfortable, familiar, it's safe, it has not changed. Let it go.
Or they're related.
That's it, that's all. All right. It is my pleasure to be here with all of you today. Thank you so much.
Thank you, Bridget. Thank you all for coming out, and for those who joined online, we'll see you again next month. And if you have any questions, come on for